only thing I would say to complement that is really emphasize staying home. For some people, it's struck a chord and they understand what that means, and they truly are staying home, isolating themselves. There still are a lot of people going out for non-essential reasons. The key way that we're going to contain this pandemic is stopping the spread of it. And I see on the internet and social media, different exchanges of information, that a lot of people are asking, how can I help out with the pandemic? How can I help my fellow Americans? And I would say, first and foremost would be to stay home. And it sounds very simple, and you may not get as much enjoyment out of it as going over to your neighbor's house and helping them with chores. But I would say it's really critical. And I wish I could share my screen. I have a really great sort of animated graph that will show you, and some of you may have already seen it. It's on New York Times and a few other major newspaper websites. But you see right now where we are as far as the prevalence, it's very low. The wave came from China to Italy, Iran, Spain. Now we're seeing the effects in New York. If some of you have been watching the news, you'll see that already our hospitals are overloaded. We just have not had enough time to prepare to have enough supplies, masks, ventilators. At Columbia University right now, they're using sharing vents for 2 patients. And I don't think some of this is new for all of us. But what we're trying to do is make sure that we're giving the highest quality of care to as many people as possible. If we're able to stay at home, if you feel ill, right now I would plan, who am I going to call? What am I going to do if I get sick or if my family member gets sick? What you want to do is you want to call. You want to call ahead so that the emergency department or the hospital can triage you appropriately. And if you do have COVID, we don't want that to be exposed to everybody else in the hospital and emergency department. Ideally, what I've been working on is a telehealth program where at home, if you start to have symptoms, and depending on what insurance plan you have, there's a telehealth option, I would go for that. If we're able to evaluate all of our patients via telehealth or telephone, we avoid the overuse of gowns, of gloves, of masks. If we can successfully do that on a large scale, then we can avoid the shortage. Then we can avoid all of the fearful things that we're hearing on the news. And all of it comes back to the very simple mantra of stay at home. Doesn't mean don't seek care. Definitely seek care. And if the only way, if you don't have a phone number to call, there's no other way to reach a provider than to transfer yourself there, then do that, because that comes first. But I would first try to reach out in a way that doesn't involve face-to-face contact. I think that's critical in really addressing this pandemic right now. Another issue that I've personally been interested in is public charge. So I think public charge is a public health threat. One cannot contain a virus outbreak by providing care to only some of the population. We cannot successfully contain a viral outbreak if there are those among us who are afraid to seek care. It's going to break down. Those who are afraid to seek care, those who are unable to have care, who have no access, are going to be harbingers of the virus. And there'll be no way to really clear infection of everyone. This is a time, historically, we've always seen pandemics as a time when we all come together because we realize, and it's not just philosophical, but by caring for others, you're caring for yourself. And that's really the only way to address a viral outbreak in a pandemic. And so some of us have written an article recently that we're submitting to a journal as we speak, where we're asking to ensure access to publicly funded health insurance for everyone, including undocumented immigrants. Only 8% of citizens were uninsured, but immigrants, undocumented, 23 and 45% among undocumented immigrants have no health insurance. We want to stop detaining immigrants that are seeking healthcare. Every healthcare site should be an ICE-free zone. And it does say that on paper, but media has covered stories where those undocumented immigrants, while seeking care, ICE did enter that establishment and detain them. We have to stop that. Otherwise, we're not going to stop this outbreak. Where we have 20% of adults right now from low-income immigrant families have reported avoiding public benefit programs for fear of risking future green card status. 20%. That's not compatible with containment. We need to eliminate overcrowding in the detention centers. Whenever there's an outbreak, overcrowding is your enemy. It's part of the virus. If the viral outbreak happens at the detention center where there's overcrowding, it will be very difficult to contain and very quickly would spread, and the entire detention center will be infected, including the guards who are going home to their husbands and wives, and then once again, unable to contain. We need to dismantle the Remain in Mexico program. These were people in the United States who were seeking asylum and have now been forced to wait in a country that most of them are not from. Most of them are intense, and if they're in the process of seeking asylum, then they've already passed the first few steps that their story is believable and that they're on to the next step. And if you're there, you really should have the opportunity to wait in the country where you're seeking refuge.